Hey everyone, Ben with Green Feet Medical. Today we're going to tackle the topic of improvised tourniquets. Our motto is, if you're planning to improvise, you're planning to fail. That's because improvisation isn't a plan. It's what you do when you don't have a plan or your plan fails. Listen, we aren't against it, we just support judicious use of improvised techniques, especially for life-saving interventions. Let's start by focusing on the basics before moving to improvised medical interventions. Let's say someone is suffering from an arterial injury. Without intervention, they will die in as little as 2 minutes. You should plan to apply a purpose-made tourniquet, such as a North American Rescue Cat or a soft tourniquet. If you do not have access to one, before trying your hand at improvised tourniquets, let's attempt to stop the bleed with wound packing. And here's why. We can begin to stop the bleed faster. It doesn't require knowledge beyond the basics taught in any Stop the Bleed class. It does not require as many extra materials, and you are likely to have a better chance of stopping a bleed by wound packing rather than improvising a tourniquet. Where does improvisation fit in? Outside of theater, after you've mastered the basics. Then you can begin to understand how we could improvise certain interventions. You can improvise wound packing material if no purpose-made supplies are available. In a pinch, splints, hypothermia management, burn care, patient packaging, and litters can be improvised. Just remember, when you use techniques not taught in a nationally recognized course, you're opening yourself up to increased liability. But Ben, surely there's a place for improvised tourniquets. You're right, it's our third option, or nearly our last option. If no tourniquet is available and wound packing has failed to stop the bleed, then you can consider applying an improvised tourniquet if you have the appropriate materials and training. However, we personally would still opt to repack the wound. Now let's see how to wound pack with improvised materials. I have to say it, if you have the materials, use the appropriate purpose-made medical supplies for the job. That's always going to be the easiest option. But let's say you don't have that, the wound, you don't have a tourniquet, you're going to go for some wound packing. Now, not all wound packing supplies are built equal. Some people would suggest using something like this. At Green Feet Medical, that's not what we're going to choose. We're going to choose something that's readily available. It's a t-shirt, a thin t-shirt. You can find these pretty much everywhere. And we're going to cut it into strips to make it easier to wound pack, because taking the whole shirt and simply trying to shove it into the wound really isn't going to work. So let's cut that into strips. And to do so, I'm going to use some good, dare say great shears from a reputable company. Okay, so I've cut a few strips of the shirt. Doesn't have to be anything fancy, just some thin strips of the shirt, not too big. Now I'm going to still do a nice little power ball relative to the wound size. I'm going to do the same as I'd normally pack. I'd hook in, find the source of the bleed if possible, explore the wound. All right, I found the source of the bleed. I'm going to push this over the top of my finger and replace it onto that source of the bleed, and keep doing so until you've built up that mound like we always talk about. Let's take a look, go ahead. And it's not soaking through. So with proper technique, it did take a little more effort to stop that bleed, and it didn't start occluding it until later, as opposed to using Curlex. But with proper technique, you can at least occlude a hemorrhage with a t-shirt, and we used about 3 or 4 strips of the shirt in there as well. Here's how to properly improvise a tourniquet. Here we go. Okay, improvised tourniquets. You've done everything in your power not to improvise a tourniquet, but hey, now you got to do one because your wound packing did not work. First things first, like any good application of a tourniquet, remove bulky items from the pockets, identify the source of the bleed, and then make sure you're at least 3 inches above the source of the bleed, not over a joint. So I have a triangular bandage because I just carry that around with my Red Clover Coffee bean scooper. You're not going to want to use a dead branch or a pen. They usually don't work for this sort of pressure. I'm going to slide this under here, keeping the triangular bandage as wide as possible, but it's going to kind of fall in on itself. And then we're going to do a simple overhand knot. So, like how you're trying to start tying your shoe, cinch this guy down. Now it's time to put the windlass in there, or improvised windlass. It's going to be this Red Clover Coffee bean scooper, like I said. We're going to do a simple square knot over it. So, right over left, cinch it down nice and tight here, left over right. And if you don't know a knot, tie a lot. Then you're going to take your windlass and begin turning. This is not going to be comfortable. It's going to be more uncomfortable than a tourniquet because all this fabric is going to be pulling on their skin a lot more on a smaller surface area. So Mason's already grunting. So we're going to turn this until bleeding is controlled, which if your windlass isn't strong enough, it might break. Now it's time to secure it. This is often the hardest part of the improvised tourniquet, and that's because you may not have enough tail left, especially if you're doing it on a leg, to actually secure this. I actually don't right here. It's just not quite enough to make sure that stays in place without lifting his leg up a whole lot, and even then I have about 2 inches of tail. So what you can do is use another piece of cloth or a triangular bandage or something of that nature, and all you're going to do is take it and make sure you're wrapping, pulling this way once, then you can wrap around here and pull this way. And if you want to doubly secure it, you can do another one if you have enough, but then you'd pass this under, so you're keeping it in place, and then you're going to tie a square knot with what's left. So this guy goes this way, cinch it down, and comes over the top and tie through. And there you have your improvised windlass now secured. You're going to lose a little bit of tightness. It's just the way it is with improvised tourniquets. Now that you have an understanding of why we avoid improvising tourniquets, get out there and start practicing wound packing. Thanks for watching.